All right, so the female sex hormones, estrogens, progesterones. Okay, on table 1811, you will find these items. Okay, it says the human body normally produces three estrogens: estradiol, estrone, and estrol. Estradiol is the major estrogen in the body and is much more potent than the other estrogens. Ovary secretions of estradiol is as part of the normal menstrual cycle, and a level of 200 micrograms or more is required for ovulation to occur in your patients. Small amounts of estrone are also secreted from the ovary, but most estrone comes from adrenal androgens that are converted to estrone in peripheral adipose skin tissue, and estriol is a metabolite of estrone and estriadol. So, action. Used for hormone replacement therapy and menopause and other conditions such as ovarian failure, infertility workups, palliative breast cancer treatments, and such. Okay, it says exogenous estrogen aid in the development of both primary and secondary sex characteristics, include growth and development. Let's see if we can highlight this here. Okay, growth and development of the uterine and masculine endothelium, vaginal epithelium, and fallopian tubes. Development of breasts, control vaginal pH, decrease uterine motility, growth of axillary and pubic hair, decrease long bone growth and pubertal girls, decrease calcium loss from bones. And it says estrogen also suppresses the release of gonadotropins as well. Estrogen are anabolic and cause retention of salt, water, triglycerides, and decrease in cholesterol. Uses. Like I said, hormone replacement therapy and menopause and other conditions. It says they are in fertility workups for palliative therapy, prostatic cancer, and breast cancer that occurs at 5 years after menopause. In many years of controversy, it says has now been demonstrated conclusively that estrogens are effective for prevention of most postmenopausal osteoporosis. Okay, but they do not increase the risk for stroke, heart attack, and breast cancer. All right, so let's look at some adverse reactions. All right, some of your adverse reactions include edema, thrombophlebitis, depression, migraines, headaches, skin rashes, decreased glucose tolerance, nausea, vomiting, breast tenderness, enlargement. It's a long list, right? Vaginal candidiasis, and changes in weight and libido. Some drug interactions, okay? Your rifampin, barbiturates, and some other antibiotics may reduce the effects of estrogen, okay, especially those in contraceptives. And estrogen may reduce the effects of oral anticoagulants and tricyclics, anticonvulsants, and anti-diabetic agents. All right. Let's look at progesterones. Action. Okay, it says it causes uterine endometrium to shed during menses after tissue growth. They maintain the endometrium and vaginal epithelium and decrease uterine motility during pregnancy. It says acting with estrogen, they cause the breast to secrete milk and become more vascular. It says it can suppress ovulation, control uterine bleeding caused by hormonal imbalance, increase sodium excretion, and cause negative nitrogen imbalance. Uses: contraception, okay, excessive uterine bleeding, dysmenorrhea, premenstrual tension, okay, and control pain and in endometriosis. All right, so adverse reactions. All right, it says include fluid retention, thromboembolic events, dizziness, headache, tolerance, diarrhea, jaundice, amenorrhea, breast tenderness, enlargement, decreased libido, increased vaginal discharge, spotting. Overdosage produces change in menses, nausea, vomiting, and withdrawal. All right, and drug interactions says alters the effects of laboratory tests. So let's look at some of the patient teachings. All right, so does patient have history of ovarian failure? Is there a need for contraception? You can see here. All right, what is the reason they need the medications? Presence of dysmenorrhea. It says for patients near the age of menopause, see if they have history of hot flashes, menstrual irregularities. Okay. Progesterones should not be used during pregnancy, especially in the first 3 months because of the risk of congenital abnormalities. Okay. There's also an increased risk of gallbladder disease with long-term use. Okay, and it says postmenopausal estrogen therapy is associated with an increase in the risk of endometrial cancer 5 to 10 times the normal risk. So patient, family, and teachings. By law, it says estrogenic drugs by law must be dispensed with a patient package insert titled What You Should Know About Estrogens. So the patient should read that over and instruct your patients about that. Right? Talk to them about the side effects. Okay, it says the patient should stop taking the medication and contact the nurse or physician or other healthcare provider immediately if there's chest pain, abdominal pain, leg pain, swelling, severe headache, visual changes. Any of this takes place, they should stop right away. All right, the patient should discontinue immediately if she believes she's pregnant. All right, look for signs and symptoms such as skin rash, breast lumps, jaundice, mental depression. They should seek medical attention. Okay, let them know that nausea and breast tenderness may occur early in therapy but should lessen after 1 to 3 weeks. Okay, use of estrogen replacement is associated with an increased risk of developing endometrial cancer. All right, read over this here, 1810, your estrogen and progesterones. It says the patient should take the pill exactly as ordered. Okay, when used for short-term dysfunctional bleeding, progesterone should first stop the bleeding and then cause endometrial lining to shed. Improvement of heavy bleeding should occur within 24-48 hours. All right, diabetic patients should let them know. Tell a healthcare provider before they begin developing positive urine tests. And then herbal products should also be documented as well. All right, so oral contraceptives. All right, you have your combination drugs, estrogen and progesterone. Okay, it says the principal action is to prevent ovulating by inhibiting follicle-stimulating hormone and luteinizing hormone. Okay, oral contraceptive pills, it says come in a variety of combinations, including those like Yasmin with very low estrogen content. Also says oral contraceptives are used to prevent pregnancy when a highly effective method is needed and heterosexual activity is regular. So adverse reactions. It says most are caused by hormonal imbalance. These types of imbalances and the symptoms they cause include some of the following. So highlight these. Read over these guys. Okay. So you can see it says may produce nausea, dizzying, vomiting, edema, cyclic weight gain, bloating, increased fibroid size, phlebitis, cerebral vascular infarction. Progesterone may cause increased appetite, weight gain, cholestatic jaundice, decreased length of menstrual flow. Androgen excess may produce increased appetite and weight gain. Hair growth, acne, oily skin, rash. Estrogen deficiency may cause irritability, nervousness, hot flashes, vasomotor spasms. It says also spotting, decreased amount of menstrual flow, no withdrawal bleeding, decreased libido. It says progesterone deficiency may also produce late breakthrough bleeding, spotting, heavy menstrual flow, and weight loss. Okay. You also have emergency contraceptive. Okay, it says anytime a woman has unprotected intercourse and does not want to become pregnant, she may use an emergency contraception kit containing 2 tablets of selected combined oral contraceptive pills. Treatment must be started within 72 hours of intercourse, with 2 doses taken 12 hours apart. It says emergency contraceptive pills work primarily by blocking or delaying ovulation or by changing the way sperm or ova are transported. Drug interactions. It says there may be an increase in breakthrough bleeding, decrease in contraceptive effectiveness, may have an effect with antibiotics, barbiturates, and anticonvulsants. Oral contraceptives can decrease the effectiveness of anticoagulants, antihypertensives. It says some antibiotics reduce the effectiveness of oral medications. So patient teachings and implications. Learn as much as you can about the patient's history, thorough menstrual cycle contraceptives that's currently being used, reproductive history. Does the patient smoke? Are they breastfeeding? Are they pregnant? Okay. Explain to them that when they're taking these medications that they shouldn't miss any doses. All oral combination contraceptives are to be taken for 21 days. All right, and it says pills are packaged in a 1-month packet. Let's see if we can highlight it. Oh, it's messing up on me. All right, it says some preparations contain 28 pills to be taken daily, 7 of which contain an inert substance or iron. So patient and family teaching, take it exactly as prescribed. Right, let them know certain side effects. If there's pain in the chest, growing legs, sudden severe headaches, sudden slurring of words, changes in vaginal bleeding, hypertension, breast lumps should be reported. Okay, it says anorexia, acne, stomach cramps, edema of the ankles, these should be reported. The patient must return for scheduled checkups. The patient should immediately stop taking the pill if he or she thinks she's pregnant. It says the patient should keep an extra month's supply of pills just in case there's a chance of running out. It says for women younger than 40 years of age, the risk of death from complications of pills is less than the risk from death of pregnancy. It says each visit to the healthcare provider should include a history of possible side effects and adverse reactions. All right, thyroid hormones. Well, I'm going to take a break right there before we get started. I'm going to send you this video and then we'll get started with thyroid hormones.